Hi, welcome back to my channel. In the healthcare delivery system, the nurses are important members in the team since they are directly involved in the patient care. So, there are certain challenges of nursing in the COVID era because the rapid spread of COVID 19 poses a serious threat to human health and has an impact on public health, global communication, and economic system worldwide. Nurses are key members of healthcare teams charged to control and prevent the spread of infectious diseases. They work on the front line, providing direct care to individuals affected with COVID 19. Effort is necessary to develop strategic recommendations and to integrate new knowledge into nursing education. Nurses must prepare its workforce for an increase in future pandemics because of urbanization, mass travel, transit, and increased population density. Exploring the issue that nurses face when caring for COVID 19 patients will help increase nurse and hospital resilience in response to the crisis. Understanding these issues will help support nurses by informing leaders and decision makers about these issues by providing recommendations and implications. Some of the issues that I would like to discuss here are the current problem that faces healthcare delivery system in our country is the shortage of trained nursing staff in all specialties, specifically in emergency and critical care nursing. There is role ambiguity, insufficient response to urgency, low sense of responsibility, and lack of knowledge skills. The nurses on the front line of COVID care face medical risks such as injuries, infections, stress concerning the workload, depression due to the worries of their family and children, shortage of PPE, which are essential to prevent infection, lack of health insurance coverage, lack of counseling in distress. Nurses are challenged to restrict many COVID 19 patients from having end of life communication with their families. Some of the recommendations that I would like to give are it might be useful to bring on board nursing experts with the ability to deal with emergencies, outline the possible risks from the pandemic, and create short term and long term plan to modify these risks. Call for all experts, retired or senior staff nurses who have essential knowledge, skill, and attitude to provide holistic care. Call for volunteers such as interns or students who are willing to have experience in the clinical setting. Senior nurses must have a clear plan to manage and supervise volunteers. Standard operating procedures, infection control policies should be made available to all nurses for reference whenever required. Regular visits from supervisors and daily monitoring of clinical areas should be done to motivate the nursing staff to adhere to their schedules. Psychological well being and management of stress levels are as important as physical health. Recommend for healthy lifestyle strategies, including staying hydrated, maintaining healthy eating and sleeping pattern, and keeping up social contact with support network, even if that contact is virtual. Empower nurses by involving nurse leaders in framing policies regarding better remuneration, insurance, job descriptions to safeguard nurses working in the health sector. Undergraduate curricula should include more content and clinical experiences in emergency, critical care, public health nursing, disaster preparedness, and basic principles of epidemiology. Thank you. If you want to share your personal experiences during care of COVID patients during the last 1 year, feel free to comment below.